Well, you remember a few years ago when I shaved my head, I found these things on top of my head, which I was a little concerned about. So I did go to have them checked. Fortunately, it turned out to be nothing serious, but could be different for somebody else. Could be something serious. Well, today on the show, we're at South Mississippi Surgeons here talking to Dr. Scott Brashier. How are you, sir?
Good, sir. Thank you.
Now, you're a general surgeon with South Mississippi Surgeons. If you would please tell us a little background about yourself.
Sure. I was born and raised around the Meridian, Mississippi area, and went to school at Ole Miss and went to medical school in Kentucky, followed by my general surgery residency into the Detroit area, and then I moved back down this way and have been with South Mississippi Surgeons for a year now.
Mm-hmm. Now, we're talking primarily about lesions today to check out, but there are other areas that you do as far as a surgeon.
Sure, yeah. We do specialize in skin, and we call it integumentary systems. Is a big part of our training in residency, but we also do a lot of abdominal type surgeries, gallbladder surgery, colon surgeries, breast surgeries for cancers, and
Right.
Things of that nature, as well as other lumps and bumps that you're unsure what they are. You know, we can definitely evaluate that and decide what needs to be done, if anything, to help those types of problems. But yeah, there are many different things. We use a robot, the Da Vinci robot,
Yeah,
for
I've seen those work. That are really
a lot
cool.
of our surgeries, and
It's
really
amazing how
helping
far
outcomes.
technology has come nowadays and really making your job, I don't want to say so much easier, but just very, very precise.
Precise.
Yeah.
That would be the right word for sure. A lot of us general surgeons were somewhat late to adopt the idea that we would use this Da Vinci robot, as we did a lot of these surgeries with the laparoscopes and essentially the same type of surgery. But as we've become used to using the robot, we've gotten our surgical times down to essentially equivalent, and patients really do have less pain and discomfort after.
Yeah, and quicker recovery time.
Quicker recovery
That's one of the
time,
big.
that's
That's
right.
one of the big things there. Let's talk about skin lesions. You know, I mentioned these spots on my head, which fortunately turned out to be nothing serious. But I guess living down here, people are out in the sun a lot. I mean, any kind of suspicious looking thing, they should not, linger in getting it checked out.
That's right. You know, and people, in my experience, they watch these things for year after year, and they say, well, I never wanted to go get this checked until it really does become a big problem. But it's funny you mentioned the idea of sun-exposed areas, which is forever known as a time that a risk factor for developing skin cancers. But I see the majority of my patients, and they have a problem not necessarily in the sun-exposed
Really?
area. And so I think some people say, well, that's not in a sun-exposed area, it must not be anything. Sun exposure and tanning bed exposure is a risk factor for developing a skin cancer, but definitely not the only reason for having one. So even if it's in a non-sun exposed area, it very well may be a skin cancer, sure.
Is it true that sugar can I don't know. I've heard that is if you've got any kind of cancerous thing, it's almost like it feeds it.
Yeah, that
I've heard that from nutritionists.
sure. Proper glycemic control is important for a lot of body conditions.
Yeah, that's what I was getting. I mean,
right.
yeah.
So I don't know of any one specific study that would, tell me that, well, high sugars
Could contribute to
contribute
it, yeah.
to the formation of that. But we do notice, with people who have uncontrolled sugar, that they have a lot of other problems as well. So
Yeah.
I mean, it's definitely linked there.
Now, somebody sees something, what on themselves? I mean, like you said, you don't have to necessarily be in the sun,
Right.
Because I've had seen people that had a mole or something on there, and it's like you want to tell them you really need to go get that checked. And I mean, there's some differences in how things will look actually before you should go get it done.
That's right, and even in my training in Detroit, where there's not a lot of sun that way, we saw many skin cancers, and the things that I tell people to look for at home we talk about the ABCDEs, asymmetry. We look at the border to see what the border is looking like. If it's not, perfectly smooth, then
Right.
it very well may be something. The color and the multicolored skin lesions
Yeah.
tend to have a higher malignant potential.
Let's see.
Exposures, yeah, I have to remember my letters here.
ABC exposure, yeah.
Exposure to the sun and diameter, that was the D. Yeah, how big it is exactly. The larger the lesion, the more likely it is to harbor some malignancy of sorts.
Now, a lot of people, they may have something that's just like, these areas on my head. Didn't see them until after I started shaving my head. But fortunately, there was not like anything above the skin. It was all just kind of centered in it. Is there any difference between someone that has something like that than if somebody has like a mole that's up on top of the skin?
This raised some.
Yeah.
A lot of times the idea that it's raised also will raise some suspicion as well. But it's very difficult to know short of biopsy in the area.
Right.
There is no one that I know of, no single device or instrument or otherwise test that can really tell you whether something is a skin cancer or not 100% definitively, short of having a pathologist look at it under a microscope.
Right.
There are some different dermatoscopes and other different things that can, give you a risk of, 90% chance this isn't, but like I said, short of having the lesion itself removed is very hard to know for sure.
Now, if somebody, you go to your doctor, general practitioner, we only have a couple minutes left here.
Sure.
I guess they need to get a recommendation to come see you, or do they need, as far as if they need to get it removed?
Well, I wouldn't think so. To my knowledge, if you have something, you call our office. They should be able to fit you in. Some insurances may require
general practitioner
to refer you, but generally our office will let that person know.
Y'all have a great history. I mean, really do. We've been doing the show with South Mississippi surgeons for a few years now, and met many wonderful surgeons on here. And it's really a lot of great work that y'all are doing here. Dr. Brashier, we run out of time here.
Absolutely,
Appreciate your, it's good meeting you.
Good to meet you too.
You're one of the
new guy here.
Yeah, you're the new guy in town. I met a bunch of the other ones there. But anyway, if you have any questions or anything like that, or you have a loved one that you want to get a little bit of peace of mind and possibly get it removed, or for any of the type of the surgeons that they have here, give them a call.